Hey guys, it's Xander, and today we're going to be going over some psychiatry review questions. This is not meant to be comprehensive, but hopefully we can hit some of the highlights here. So let's get started. So, question 1. A 42-year-old woman presents with a 3-month history of depressed mood, fatigue, and anhedonia. She reports difficulty concentrating at work, sleeping excessively, and feeling worthless. She denies suicidal ideation. Medical history is unremarkable. Physical exam is normal. Which of the following is the most appropriate next step in management? A. Refer for inpatient psychiatric hospitalization. B. Prescribe zolpidem for insomnia. C. Initiate selective serotonin reuptake inhibitor. D. Start dialectical behavior therapy alone. Or E. Order MRI of the brain. So the correct answer here would be C. Initiate selective serotonin reuptake inhibitor, or SSRI. This patient meets criteria for a major depressive disorder, and that definition is greater than two weeks or equal to 2 weeks of 5 or more of the following symptoms of SIGI CAPS, with S standing for changes in sleep, I standing for changes in interest, G standing for increased guilt, E standing for changes in energy, C standing for concentration, A standing for appetite, P standing for psychomotor retardation or agitation, and S standing for suicidal ideation. It has to include depressed mood or anhedonia to meet criteria. First-line treatment includes SSRIs and or CBT. Given the severity, pharmacotherapy is appropriate. If CBT was here, we'd also maybe give that some thought. DBT alone, DBT is typically used more for people with borderline personality disorder. And also with these questions, just make sure if that there's something like you want to rule out medical conditions first. So if there's something like get thyroid tests or something like that, that's something that you'd want to do first before initiating treatment. So very good. So question 2. A 28-year-old man comes to the ED with sudden onset chest pain, shortness of breath, and palpitations. He feared he was dying. Symptoms resolved within 30 minutes. Cardiac and pulmonary workup is negative. He reports similar episodes 3 to 4 times per month, avoiding grocery stores where they most often occur. Which of the following is the most appropriate treatment? A. Propranolol as needed. B. Clonazepam daily. C. Refer for cardiac stress testing. D. Cognitive behavioral therapy and SSRI. E. Alprazolam PRN. So the correct answer here would be D, cognitive behavioral therapy and SSRI. So this is panic disorder. It is characterized by like somatic symptoms such as like palpitations, shortness of breath, chest pain, as well as cognitive symptoms like fear of dying, which this person had, in addition to wanting to avoid or maladaptive behaviors, which is like avoiding the grocery store here. And first line would be SSRIs and CBT, which are both first line. So question 3, a 25-year-old man is brought by the family for bizarre behavior. For 8 months, he hears voices commanding him to isolate, believes that the government is tracking him via his microwave, and has withdrawn from work and friends. He has poor hygiene and blunted affect. Urine tox is negative. What's the most likely diagnosis? A. Brief psychotic disorder. B. Schizoaffective disorder. C. Delusional disorder. D. Schizophrenia. Or E. Schizophreniform disorder. So the correct answer here would be D. Schizophrenia. So this patient has greater than 6 months of positive symptoms, which include delusions, hallucinations, and also has negative symptoms like blunted affect and withdrawal, and functional decline consistent with schizophrenia. And it's greater than 6 months, so that rules out schizophreniform. And a mnemonic that I use to help remember this is, I guess it's not really a mnemonic, but I just remember DHSBN. You can make a mnemonic from that, but that stands for delusions, hallucinations, speech, B for behavior, and then N for negative symptoms as well. So question 4, a 33-year-old woman with bipolar 1 disorder on lithium presents for routine follow-up. Labs reveal a creatinine of 1.4, TSH of 7.5. So those are both elevated, in serum lithium of 0.9, which is therapeutic. She denies weight gain, constipation, or depression. What's the most likely explanation for these findings? So the correct answer here would be B, lithium-induced hypothyroidism and nephrotoxicity. Lithium toxicity can present with nephrogenic, diabetes insipidus, CKD, or hypothyroidism, and that's most likely the explanation for the creatinine and TSH elevation here. So question 5, a 16-year-old girl is brought in by her mother due to a 20-pound weight loss. She eats less than 500 calories a day and exercises compulsively. BMI is 16.2. Labs show low LH, FSH, T3, and normal TSH. She denies purging. What is the most likely findings you're going to see? A, elevated cortisol. B, bradycardia. E, elevated T3. D, hypernatremia. E, erythema nodosum. So the answer here would be B, bradycardia. So anorexia can cause physiologic adaptations and starvation, and these include sinus bradycardia, hypotension, hypothermia, amenorrhea, and low gonadotropins. So yeah. Question 6. A 76-year-old man is hospitalized for pneumonia. On day 3, he becomes disoriented, agitated, and tries to remove his IV lines. He is alert but inattentive and distractible. His vital signs are stable. No focal neurologic deficits are present. Which of the following is the most appropriate next step? A, start risperidone. B, administer lorazepam. C, obtain non-con CT of the head. D, reorient the patient and minimize nighttime disturbances. Or E, administer haloperidol. So the correct answer would be D, reorient the patient and minimize nighttime disturbances. So this is delirium, and it's commonly due to hospitalized patients, whether they have an infection, or it could also be due to polypharmacy in elderly patients. And non-pharmacologic strategies are first line. So question 7. A 21-year-old college student reports spending 3 to 4 hours a day arranging his books and checking locks repeatedly. He feels compelled to perform these rituals to avoid something bad happening, though he recognizes his behavior is irrational. He's distressed and wants help. What's the best initial treatment? A, cognitive behavioral therapy with exposure to response prevention. B, insight-oriented psychotherapy. C, risperidone monotherapy. D, diazepam as needed. E, electroconvulsive therapy. So the answer here would be A, cognitive behavioral therapy with exposure to response prevention. So CBT with exposure and response prevention is first line for OCDs. SSRIs can be added if symptoms are severe. So question 8. A 32-year-old man is brought in by EMS after being found agitated and combative. He is diaphoretic and has dilated pupils, tachycardia, and chest pain. Blood pressure is 180 over 110. ECG shows ST depressions in anterior leads. Urine tox is positive for cocaine. Which of the following is the most appropriate immediate treatment? A, metoprolol. B, benzodiazepines. C, haloperidol. D, naloxone. E, nitroglycerin, and phlebotomy. So the correct answer would be B, benzodiazepines. So cocaine intoxication leads to sympathetic surge, hypertension, and coronary vasospasm. Benzodiazepines reduce sympathetic outflow and myocardial O2 demand. So question 9. A 24-year-old woman is hospitalized after a suicide attempt. She reports chronic emptiness and unstable relationship. She alternates between idealizing and devaluating others. She has multiple scars on her forearms, which she says doesn't feel real sometimes. Which of the following is the most likely diagnosis? A, histrionic personality disorder. B, borderline personality disorder. C, narcissistic personality disorder. D, bipolar II disorder. Or E, dependent personality disorder. So the answer here would be B, borderline personality disorder. So the emotional self-instability, self-injury, identity disturbance, and splitting are hallmark of borderline personality disorder. So that's the one. Question 10. A 36-year-old high school teacher presents for evaluation 4 months after surviving a school shooting. Since the incident, she has experienced frequent distressing nightmares and flashbacks of the events, avoids going near school buildings, and becomes extremely anxious when she hears loud noises. She reports persistent hypervigilance, insomnia, emotional numbing, and feelings of detachment from others. These symptoms have significantly interfered with her ability to work and maintain relationships. Which of the following is the most likely diagnosis? A, acute stress disorder. B, adjustment disorder. C, generalized anxiety disorder. D, post-traumatic stress disorder. Or E, panic disorder. So the correct answer would be D, post-traumatic stress disorder. So this person has hallmarks of PTSD that have lasted greater than 1 month following exposure to life-threatening trauma. Other things that this could be, adjustment disorder. So one of the diagnostic criteria for adjustment disorder is another mental disorder. It's not explained, so that's why it's not likely that. That would probably be the second thing I'd think of. So yeah. Question 11. A 34-year-old woman presents to her primary care physician with persistent fatigue, muscle tension, and difficulty concentrating at work. She reports worrying all the time about a variety of things, including her job performance, finances, and the health of her patients. Despite reassurance that everything is fine, these symptoms have been present for over a year and cause significant distress and impairment in her relationships and daily functioning. She denies panic attacks, obsessions, or substance use. She has no prior psychiatric history. Which of the following is most appropriate first line for this patient's condition? A. Clonazepam. B. Buspirone. C. Psychodynamic psychotherapy. D. Cognitive behavioral therapy and or SSRI. Or E. Hydroxyzine. So the correct answer here would be D. Cognitive behavioral therapy and or SSRI. So this patient meets criteria for generalized anxiety disorder with greater than 6 months of 3 or more of the following symptoms. So the way I remember this is worry warts. So WWARTS. The first W for worrying, the second W for worn out or fatigued, the A for absent-minded or difficulties with concentration, the R for restlessness or psychomotor agitation, T for tense muscles, and then S for sleep disturbance. And CBT and SSRI first line. So question 12. A 26-year-old woman is brought to the emergency department after being found unresponsive next to an empty pill bottle. On arrival, she is somnolent but arousable. Her ECG shows QRS widening and right axis deviation. Vital signs reveal hypotension and sinus tachycardia. She has a history of depression and was recently started on a new medication for her mood symptoms. On exam, she has dry mucous membranes, myhydris, and diminished bowel sounds. Which of the following is the most appropriate next step in management? A. Activated charcoal. B. Atropine. C. IV sodium bicarbonate. D. Flumepazinol. Or E. Physostigmine. So the answer would be C. IV sodium bicarbonate. This patient is showing signs of TCA overdose with anticholinergic symptoms such as the dry mucosa and myhydris, CNS depression, and cardiac toxicity. And IV sodium bicarbonate is the treatment of choice for TCA overdose. Question 13. A 29-year-old man is brought to the clinic by his wife due to erratic behavior. Over the past week, he has slept only 2 hours a night, but reports feeling full of energy. He quit his job spontaneously, invested in a $30,000 startup, and has been talking rapidly about launching his own cryptocurrency. He has no history of depression or psychosis and denies substance use. There's no prior psychiatric history. What's the best next step? A. Initiate mood stabilizer and assess need for hospitalization. B. Begin cognitive behavioral therapy. C. Prescribe sertraline and refer outpatient for therapy. D. Order UDS and defer treatment. Or E. Wait and monitor symptoms for another week. So the correct answer here would be A. Initiate mood stabilizer and assess for need for hospitalization. So this patient meets criteria for bipolar disorder with a manic episode with greater than 1 week of elevated mood with greater than 3 of the following dig fast symptoms. So that stands for distractibility, indiscretion, grandiosity, flight of ideas, increased activity, decreased need for sleep, and increased talkativeness. So first line for this would be a mood stabilizer and see if they need hospitalization. And obviously, or maybe not obviously, but it will be obvious, but SSRIs can worsen mania. So anytime you're starting someone on an SSRI, make sure that there's no history of mania or bipolar disorder. So question 14, a 19-year-old college student presents to the clinic complaining of fatigue and dizziness. She admits frequent episodes of overeating followed by self-induced vomiting 3 to 4 times per week for the last 6 months. On exam, she has parotid gland enlargement, dental erosions, and calluses on the back of her hands. BMI is 21, labs are unremarkable, and vital signs are stable. Which of the following is the most appropriate treatment? A. Aripiprazole. B, cognitive restructuring therapy, C, fluoxetine and cognitive behavioral therapy, D, olanzapine, or E, hospitalization for enteral nutrition. So the correct answer would be C, fluoxetine and cognitive behavioral therapy. So this is bulimia nervosa and involves binge eating with compensatory behaviors such as vomiting, laxatives, or exercise, at least for greater than 3 months. First line is CBT plus fluoxetine, which reduces the binge purge frequency. And hospitalization, sometimes you can get that can be the answer for anorexia, but usually they'll tell you that labs there's like severe electrolyte derangements or other things that would warrant hospitalizations in the question stem. So question 15. A 45-year-old man with a 20-year smoking history expresses desire to quit. He has previously tried nicotine patches and gum without success. He has no psychiatric history but has a sedentary job and describes low motivation and difficulty concentrating. Vitals are normal. He's open to trying a medication to help him quit. Which of the following would be the most appropriate treatment in this patient? A, nicotine, lozenges, and behavioral therapy. B, clonidine. C, bupropion. D, varenicline in combination with bupropion and nortriptyline. E. So the answer would be C, bupropion. Bupropion is a norepinephrine dopamine reuptake inhibitor that aids in smoking cessation, and it also helps with low motivation and concentration. It's useful for patients who are overweight and have depressive symptoms. So you're kind of knocking out 2 birds with 1 stone. So question 16, a 35-year-old woman with schizophrenia is brought to the clinic by her sister. She was recently started on haloperidol and now complains of feeling stiff and having difficulty moving. On exam, she has mask-like facial expression, decreased arm swing, and resting tremor. She denies hallucinations or delusions. Vitals are stable. Which of the following is the most appropriate next step in management? A, start clozapine. B, add benztropine. C, add propranolol. D, switch to fluoxetine. Or E, administer intramuscular diphenylhydramine. So the correct answer would be B, add benztropine. So this patient has drug-induced Parkinsonism, and it's an extrapyramidal side effect due to high-potency first-generation antipsychotics like haloperidol. Benztropine is an anticholinergic and can be used to treat these symptoms. You'd also consider stopping the haloperidol if feasible, but sometimes it's not. So, question 17. A 29-year-old woman is brought to the emergency department after being found wandering and confused in the park 100 miles from home. She cannot recall her name or where she lives. Physical exam is unremarkable. Urine tox and head CT are normal. Her husband reports no prior psychiatric history and that they recently experienced the death of a child. What's the most likely diagnosis? A, conversion disorder. B, post-traumatic stress disorder. C, schizoaffective disorder. D, dissociative and amnesia with fugue. Or E, brief psychotic disorder. So the correct answer here would be D, dissociative amnesia with fugue. Dissociative fugue is a subtype of dissociative amnesia characterized by sudden travel and inability to recall identity, often occurs after trauma or stress, and otherwise patients are normal. So question 18. A 53-year-old man with a history of major depressive disorder is brought to the emergency department after a suicide attempt. He was found unconscious next to an empty bottle of sleeping pills. He has no family nearby and was recently laid off from his job. He reports persistent guilt over past mistakes and feeling of hopelessness. He's medically stabilized but remains withdrawn and minimally communicative. Which of the following is the strongest risk factor for future completed suicide? A, living alone. B, male sex. C, age greater than 50, D, recent job loss, or E, previous suicide attempt. So the correct answer would be E, previous suicide attempt. So prior suicide attempt is the strongest predictor of future suicide. Question 19. A 22-year-old college student presents with excessive daytime sleepiness. He falls asleep during lectures and has difficulty staying awake while driving. He describes episodes of sudden muscle weakness triggered by laughter. He also reports vivid hallucinations while falling asleep and occasional paralysis upon waking. Sleep study shows decreased REM latency. What's the most likely diagnosis? A, shift work sleep disorder. B, obstructive sleep apnea. C, narcolepsy. D, generalized anxiety disorder. Or E, Klein-Levin syndrome. The correct answer is C, narcolepsy. So this is a classic presentation of narcolepsy. It's marked by daytime sleepiness, cataplexy, sleep paralysis, and hallucinations with short REM latency. So question 20. A 62-year-old man is brought to the emergency department with pounding headache, nausea, and blurry vision. He has a history of depression and was recently switched to phenelzine after failing several antidepressants. Vitals show blood pressure of 210 over 112 and heart rate of 96. He admits to eating aged cheese and red wine at a party. Which of the following best explains the patient's symptoms? A, serotonin syndrome. B, hypertensive crisis due to tyramine interaction. C, stroke from uncontrolled hypertension. D, pheochromocytoma. Or E, alcohol-induced hypertensive emergency. So the correct answer here would be B, hypertensive crisis due to tyramine interaction. So monoamine oxidase inhibitors inhibit the breakdown of tyramine, which can trigger catecholamine release and a hypertensive crisis when combined with tyramine-rich foods, such as aged cheese and wine. And this presents with headaches, hypertension, and risk of stroke. So always be careful when prescribing monoamine oxidase inhibitors. Question 21. A 38-year-old man presents with complaints of chronic insomnia and fatigue. He reports difficulty falling asleep until around 2 or 3 a.m., even when trying to go to bed earlier. He has to wake up at 7 a.m. for work and often feels exhausted during the days. On weekends, he sleeps from 3 a.m. to 11 a.m. and feels well rested. He denies snoring, sleep paralysis, or restless legs. What's the most likely diagnosis? A, insomnia disorder. B, narcolepsy. C, obstructive sleep apnea. D, shift work sleep disorder. Or E, delayed sleep-wake phase disorder. So the correct answer here would be E, delayed sleep-wake phase disorder. And one way you can really differentiate this from anything else is on the weekends when they're well-rested or not working. They are able to feel well-rested and they sleep appropriately. So question 22. A 9-year-old boy is brought to the clinic by his parents due to unusual movements and sounds. For the past year, he has repeated eye blinking, shoulder shrugging, and throat clearing. These symptoms wax and wane but are present daily. His teacher notes that he sometimes blurts out in class he is embarrassed by the symptoms but says he has to do them. What's the most appropriate initial treatment? A, risperidone. B, haloperidol. C, clonidine. D, behavioral therapy. Or E, fluoxetine. So the correct answer would be D, behavioral therapy with habit reversal training. So this is Tourette's, and first line is comprehensive behavioral intervention therapy for the tics. So question 23, a 47-year-old woman comes to the clinic reporting that her neighbor is spying on her. She says that the neighbor installed cameras to monitor her movements and has been spreading rumors about her. She appears calm, speaks coherently. She's employed, socially appropriate, and denies hallucinations, mood changes, or suicidal ideation. No evidence supports her beliefs. What's the most likely diagnosis? A, paranoid personality disorder. B, delusional disorder. C, schizoaffective disorder. D, schizophrenia. Or E, brief psychotic disorder. So the correct answer would be B, delusional disorder. So this patient has a non-bizarre fixed delusion lasting greater than 1 month without other psychotic features. So this is classic for delusion disorder. Question 24. A 26-year-old man presents for evaluation of his fear of flying. He has avoided visiting families overseas for several years. He experiences intense anxiety, palpitations, and shortness of breath when boarding a plane or even thinking about booking a flight. These symptoms completely resolve when he avoids flying. He recognizes his fear is excessive but can't control it. What's the best initial treatment? A, benzodiazepines. B, sertraline. C, exposure therapy. D, psychoanalysis. Or E, risperidone. So the correct answer would be C, exposure therapy. This is a specific phobia, and first-line treatment is CBT with exposure therapy. Question 25. A 30-year-old woman presents with a 2-year history of generalized body pain, headaches, and intermittent abdominal discomfort. She has seen multiple specialists and undergone extensive testing, all which were normal. She says the pain is ruining her life, and she frequently misses work. She appears distressed and asks for more imaging to find a cause. Her vital signs and physical exam are unremarkable. What's the most appropriate next step in management? A, schedule exploratory surgery. B, prescribe oxycodone. C, refer to a pain specialist. D, schedule regular outpatient visits with a single provider. Or E, tell the patient that the symptoms are psychological. The most appropriate thing here would be D, schedule regular outpatient visits with a single provider. So this patient has somatic symptom disorder, and it's characterized by excessive focus and anxiety on physical symptoms despite negative workups. And one thing you can do is regular visits with one provider to build trust and reduce unnecessary interventions. Question 26. A 62-year-old man is admitted to the hospital for pancreatitis. On day 2, he becomes anxious, diaphoretic, and tremulous. He reports nausea and headache. Vitals show heart rate of 120, blood pressure 158/96, and temperature of 99.8. He admits to drinking half a liter of vodka daily for the past 20 years. Labs are notable for a mildly elevated AST and ALT with AST-ALT ratio of greater than 2. Which of the following is the most appropriate next step? A, administer haloperidol. B, begin benzodiazepine taper. C, start IV thiamine and folate only. D, order MRI of the brain. Or E, observe and reassess in 24 hours. So the correct answer would be B, begin benzodiazepine taper. So this patient is in early alcohol withdrawal and is presenting with tremor, anxiety, tachycardia, and hypertension. Long-acting benzodiazepines are first line to prevent seizures or delirium tremens. Question 27. A 10-year-old boy is brought in by his parents due to poor school performance. His teacher reports that he's frequently out of his seat. He blurts out answers and cannot focus on tasks for more than a few minutes. He struggles to complete his homework, forgets assignments, and often interrupts conversations at home. These behaviors have been present for several years and occur across multiple settings. What's the best initial management? A, stimulant medication. B, parent-child interaction therapy. C, family therapy. D, risperidone. Or E, atomoxetine. The correct answer here would be A, stimulant medication. So this child meets criteria for ADHD with hyperactivity, impulsivity, and inattention in multiple settings. Stimulants are most effective and first line. Atomoxetine is second line, but stimulants are typically first line over a non-stimulant. But some patients might go that route in a clinical setting. Question 28. A 17-year-old girl with anorexia nervosa is admitted for medical stabilization. She has a BMI of 15, dry skin, and luengo. Labs reveal hypokalemia, hypophosphatemia, and prolonged QT interval on EKG. She started on nutritional rehabilitation. 2 days later, she becomes weak, confused, and develops seizures. What's the most likely cause of her symptoms? A, hypoglycemia. B, hyponatremia. C, refeeding syndrome. D, central pontine myelitis. Or E, cerebral edema. The answer here would be C, refeeding syndrome. So refeeding syndrome occurs when malnourished patients are refed, triggering insulin release, which drives phosphate, potassium, and magnesium into cells, causing electrolyte shifts, seizures, and arrhythmias. Question 29. A 41-year-old man with history of depression is started on bupropion. 2 weeks later, he presents after a witnessed tonic-clonic seizure at work. He denies alcohol use or drug use. PMH is notable for an eating disorder in college and recent efforts to quit smoking. His only other medication is nicotine gum. Which of the following is the most likely contributor to his current condition? A, hyponatremia. B, bupropion-induced seizure in a patient with eating disorder history. C, withdrawal from nicotine. D, excessive caffeine intake. Or E, SSRI-induced serotonin syndrome. So the correct answer would be B, bupropion-induced seizure in a patient with eating disorder history. So bupropion lowers the seizure threshold, especially in patients with anorexia or bulimia, and it's contraindicated in this population. Question 30. A 31-year-old man with schizophrenia is hospitalized after developing fever and confusion. He was started on flufenazine 3 days ago. He's febrile, tachycardic, and rigid on exam. Labs reveal leukocytosis, elevated creatinine kinase, and transaminitis. Creatinine is also elevated. Which of the following is the most appropriate next step in management? A, administer lorazepam. B, start dantrolene and discontinue antipsychotic. C, discontinue antipsychotic and provide supportive care. D, start bromocriptidine and continue antipsychotic. Or E, switch to clozapine. The correct answer is C, discontinue antipsychotic and provide supportive care. So this is NMS, or neuroleptic malignant syndrome, and it presents with fever, rigidity, autonomic instability, and elevated creatinine kinase from dopamine blockade. And you want to immediately discontinue the antipsychotic and provide supportive care like IV fluids, cooling, and ICU monitoring. Question 31. A 28-year-old medical student fails an important licensing exam. The next day, she tells her friends that the test wasn't really important anyway, and insists that she never really cared about that specialty. When a roommate tries to comfort her, she quickly changes the subject and smiles and says everything happens for a reason. What's the following best defense mechanism that explains this behavior? Sorry, this hit too close, that's why I got stuttering. A, reaction formation. B, projection. C, rationalization. D, repression. Or E, sublimination. So the correct answer is C, rationalization. This is classic rationalization. You're making excuses, explaining away an unpleasant reality to avoid emotional discomfort. So just going over some of the others. So reaction formation is expressing opposite feelings, like being overly kind to someone you hate. B is projection, so attributing one's own feelings to others. D is repression, so that's unconsciously blocking out distressing thoughts. And E is sublimination, which is channeling unacceptable impulses into socially acceptable activities like boxing to express aggression. Question 32. A 36-year-old man with generalized anxiety disorder and depression is started on sertraline for 4 months. His mood and anxiety symptoms have improved, but he now reports difficulty achieving orgasm and reduced sexual desire. These symptoms are distressing and affecting his relationship. He is otherwise healthy and does not use other substances. Which of the following is the most appropriate next step? A, increase sertraline dose. B, add alprazolam. C, switch to bupropion. D, reassure and monitor. Or E, add sildenafil. The correct answer would be switch to bupropion. SSRIs commonly cause sexual side effects, including decreased libido and anorgasmia. Bupropion enhances dopamine and norepinephrine. This has minimal sexual side effects and is a good alternative to SSRIs. Question 33. A 50-year-old woman presents with a 6-month history of difficulty falling asleep, staying asleep, and feeling tired during the day. She lies awake for hours and checks the clock frequently. She spends nearly 9 hours in bed each night, but estimates she only sleeps 4 to 5 hours. She has tried over-the-counter sleep aids without success. She does not drink caffeine in the evening and exercises regularly. Which of the following is the most appropriate next step in management? A, prescribe zolpidem. B, initiate cognitive behavioral therapy for insomnia. C, recommend melatonin. D, begin sleep restriction therapy. Or E, order a sleep study. Their correct answer would be B, initiate cognitive behavioral therapy for insomnia. So CBT is first line for insomnia, and it can teach things like stimulus control, sleep restriction, and cognitive restructuring, and sleep hygiene. Question 34. A 45-year-old woman presents for evaluation after a workplace shooting. She was unharmed but witnessed several coworkers being injured. For the past 5 weeks, she experiences intrusive memories, nightmares, and avoidance of office buildings. She also reports irritability and poor sleep. She has no prior psychiatric history. What's the most likely diagnosis? A, acute stress disorder. B, post-traumatic stress disorder. C, adjustment disorder with depressed mood. D, generalized anxiety disorder. Or E, major depressive disorder. So the correct answer here would be B, post-traumatic stress disorder. This patient has PTSD, and it began after trauma and lasted more than 1 month. So I think we actually had a question about this before, but we can go over it again. So acute stress disorder would be less than 1 month, so it's acute. And adjustment disorder, so one thing about adjustment disorder is you want to rule out all other mental disorders before clicking this. And D and E don't explain the trauma-specific symptoms. Question 35. A 15-year-old girl presents with patches of hair loss on her scalp. She initially denies pulling her hair, but later admits to doing so. When feeling anxious or stressed, she reports a sense of relief afterwards. She denies hallucinations or suicidal ideations. Exam reveals irregular patches of hair loss with hairs of varying length with no inflammation or scarring. What's the best initial treatment? A, fluoxetine. B, antipsychotic medication. C, habit reversal therapy. D, topical corticosteroids. Or E, reassurance and observation. So the correct answer would be C, habit reversal therapy. So this is trichotillomania, and it's a body-focused repetitive behavior that's best treated with habit reversal therapy, which is a form of behavioral therapy. Question 36. A 39-year-old woman presents with chronic abdominal pain and fatigue that have persisted for over a year. She has seen multiple physicians and undergone extensive lab tests and imaging, all which were normal. She continues to believe something seriously wrong with her body. She frequently misses work due to her symptoms and spends hours reading medical websites. She appears anxious and frustrated during the visit. Which of the following best differentiates somatic symptom disorder from illness anxiety disorder? A. Duration of symptoms. B. Severity of impairment. C. Numerous healthcare visits. D. Presence of physical symptoms. Or E. Associated anxiety. So this would be the presence of physical symptoms. D. So somatic symptoms disorder is characterized by one or more of physical symptoms that cause significant distress and functional impairment. In contrast, illness anxiety disorder involves minimal or no actual physical symptoms. Question 37. A 23-year-old woman is diagnosed with obsessive compulsive disorder. She spends 4 to 5 hours a day checking that her appliances are off and doors are locked. She recognizes that the behavior is irrational but cannot stop herself. She's tried behavioral therapy but only made minimal progress. She has no history of substance use or other psychiatric illnesses. Which of the following is the most appropriate next step? A. Alprazolam. B. Venlafaxine. C. Fluoxetine. D. Haloperidol. Or B. Bupropion. So the correct answer would be C. Fluoxetine, as SSRIs are first-line treatment for OCD. Question 38. A 19-year-old man is arrested for breaking into several homes. He has a history of fighting, truancy, and cruelty towards animals beginning in childhood. He shows no remorse for his actions and says they had it coming. He has previously been suspended from schools multiple times and was previously diagnosed with conduct disorder at age 14. Which of the following is the most likely diagnosis? A. Narcissistic personality disorder. B. Antisocial personality disorder. C. Borderline personality disorder. D. Oppositional defiant disorder. Or E. Intermittent explosive disorder. So the correct answer would be B. Antisocial disorder. So this is only diagnosed in patients greater than 18 years old, and they have to have a history of conduct disorder before age 15. And clinical symptoms or clinical presentations are violation of social norms and rights of others, lack of remorse, and deceit and aggression. Question 39. A 58-year-old man with hypertension and hyperlipidemia wants to quit smoking. He has smoked 1 pack per day for 35 years. He has tried nicotine replacement and bupropion in the past without success. He denies any psychiatric history and is motivated to quit. Which of the following is the most appropriate next steps? A. Recommend nicotine patch with gum. B. Start nortriptyline. C. Prescribe varenicline. D. Start a combination of varenicline and bupropion. Or E. Refer for group hypnosis. So the correct answer would be C. Prescribe varenicline. Sorry, I was pronouncing that wrong earlier. So varenicline is a partial agonist for nicotine receptors and is highly effective for smoking cessation and can be used as monotherapy in patients who have failed other treatments and have had no history of depression or suicidal ideation. Question 40. An 82-year-old woman is brought to the ED by her daughter due to confusion. She was previously oriented and independent but became acutely disoriented in the morning. She cannot recall where she is and becomes agitated when asked about the date. Her vitals are normal. Physical exam is unremarkable. She was recently started on oxybutynin for urge incontinence. Which best distinguishes delirium from dementia in this patient? A. Age of onset. B. Presence of urine incontinence. C. Level of alertness. D. Acute onset and fluctuating course. Or E. Response to anticholinergic medication. The correct answer here would be D. Acute onset and fluctuating course. So this delirium is marked by onset and fluctuating mental status and inattention, often triggered by medications, infection, or metabolic derangement. Dementia is usually gradual or progressive.